I currently have my own clinic in Temecula, California, about an hour north of San Diego, where I see patients and help them really address the cause of disease and do the right testing and interpret the testing in the right way, and not just put people on medicines that improve symptoms but actually potentially make the problem worse. What I've learned over this time is that disease is primarily caused by the choices that we make in our lifestyle and our diet. So as if we don't pay attention to what we're eating, we're never going to solve this riddle of healthcare. We're never going to get out of this huge economic burden of a healthcare system that is crashing before us. And so if we can get more people to be aware of what actually causes disease, which is what we eat, okay, and that we need to start moving away entirely, completely from animal-based products, because it's those products that have the most toxins in them, it's those products that have the most hormones in them, it's those products that have the most antibiotics in them, it's those products that actually causes changes to our genes that leads to disease. So if we can start putting the right thing into our body, basically a starch-based diet that's rich in fiber, that's rich in whole foods, that is rich in the right type of protein and fat, that doesn't have any of the refined products that is inundating our health, that's the type of diet that changes our health very positively. As far back as the late 1970s and early 1980s, when I first heard Dr. James Anderson, this renowned endocrinologist from the University of Kentucky, talk about reversing diabetes, even in people who are laying in hospital beds. Okay? He was reversing diabetes in them, and they weren't doing anything but just getting on a right diet in the hospital. If we could just start changing the hospital food, we could dramatically improve health. But if we could start applying that to our daily lives, okay, the vast majority of everybody with type 2 diabetes, heart disease, etc., can reverse it. Okay? It's not the anomaly of somebody that reverses their diabetes. Every physician who's paying any attention knows that, there's a few patients out there that have been able to reverse their diabetes, but they're not responsible for that. If they were taking the responsibility to educate their patient properly, the vast majority, we're talking about in the 90% range, can reverse that. Okay, and dramatically improve their health. Everybody can get better, and at minimum, everybody can prevent the complications of diabetes. Those are completely avoidable, okay, if we just give the body the right food. If we just focus on whole plant-based foods, the body will heal itself. When I first went to Guam in 1994, a couple of the docs there well-meaning says, Wes, you're actually going to talk to patients here about their diet. So they're not going to change. I mean, spam is king on Guam. With all the typhoons that they've been through and the wars, they're used to now just eating processed everything. They're not farming anymore. They just eat whatever they can import from the United States. But what I learned is that if we have compassion for them and we take the time to teach them, and we do programs, and we invite them into these educational programs, they will change, because people want to do the right thing. It's our responsibility as health professionals to help them understand what's actually causing their disease. So when we suggest to them that all you need to do is just take these medications and every 3 months we'll adjust them and you're going to be okay, it's basically deceiving them and stealing hope from them. What they need to understand is that 3 times a day, or maybe 20 times a day, what they're putting into their mouths is the main cause of whether they're healthy or whether they're diseased. And so over just a few years of exposure to this, I saw a nation, a territory of the United States, Guam, that had 5 times the rate of premature death due to diabetes than the U.S. mainland. I saw them transform their health. They embraced this message by focusing on a plant-based diet, on a whole foods diet. That's what we need to do. And if Guam can change, we certainly can change here in the United States or anywhere in the world. Okay? We just have a responsibility to let people know what works. And then they can make the choices. They need to know that they are the chairman of the board of their health, the chairwoman of the board of their health. And if they take control of their health and start paying attention to what is all through the medical literature, there's no argument as to what works. okay, they will get better. They can reverse disease, they can prevent disease, and they can feel better for the rest of their lives. There's been many pioneers in this field that have had arrows shot at them multiple times, and I have been one of those. I once was given a talk at a large medical conference on reversing diabetes, and the chairman of the scientific committee stood up immediately after my talk and said, I completely disagree with everything Dr. Youngberg is saying. And so there are challenges out there, but I'm really excited about what the future holds. I'm very hopeful of what the future holds. I think that this message is incontrovertible. I think that this message for people who are thoughtful, for health professionals that recognize that we cannot continue to do the things that we have been doing, because diabetes, as one example, is exponentially skyrocketing year after year after year, no matter how many new amazing medications are approved. That if medications could solve this, we would have solved this problem decades ago, but it's getting worse. And so if we're needing to look at what's the actual cause of the problem, and I think there's a groundswell, there's a momentum there that is encouraging many traditional and conventional health professionals to start asking the right questions and are open to understanding the underlying issues. Treat the cause is a movement that is taking hold now. And those of us who understand nutritional medicine are going to be at the forefront of that, helping lead that and providing motivation to people that are just looking for answers that can help their patients be successful. And so I'm very hopeful that we will be able to make a big impact in the long run by one at a time motivating our colleagues and showing them what works. They can see in the charts. They can see in patients that they're following along with me that, wow, these patients are doing so much better. And so I'm very optimistic. I tell you what motivates me. I saw my mother die at the age of 39 from cancer as a 10-year-old boy. And I told myself as a young boy that I did not want to allow this to happen to me. I remember I started reading all the health books. I tried to really understand what led to this. How could my mom, that I loved so much, die at such a young age? And the medical community at the time didn't have any answers for me. So that's why I became passionate about understanding the underlying issues, so that other families don't have to lose their mothers, their fathers, their aunts and uncles to needless deaths caused by conditions that are completely under the control of the choices that we make based on what we eat, what we drink, and how we think. And so I'm excited about this whole new understanding, this whole new paradigm of genomic medicine and epigenetics. And the driving factor of what changes the way our genes work is what we eat, the choices that we make. And so if we can just pay attention to this new research that's available to us and be true to it, we will revolutionize the healthcare industry.